Hi. Today we're going to discuss trauma-informed care. This is going to sound similar to TBRI, trust-based relational intervention, where trauma-informed care responds to the impact of trauma on a child's behavior, learning, and emotions. Number one, understand the impact of trauma. It's hard for us to assist students if we don't understand the impacts. Children may have difficulty managing their emotions or focusing because of past pain. Some of us right away in the classrooms want to discipline a child for not listening and think they're just being salty or misbehaving, but it's probably and could likely be due to trauma. What does this look like in the classroom? They're unable to focus, they're easily frustrated, and not just behaviorally. It could be emotionally, it could be academically. And how do we assist them? We assist them by calming them down. I see you're upset. Is this math too hard for you? Is it too difficult? Let's take a break. Okay. Number two, create safe, predictable environments. Again, students who have trauma do not feel safe most of the time. This needs to help feel safe and in control. How do we do that? We use visual schedules, reminders of transitions, so that they know what to expect, and this will reduce their anxiety. Again, children in trauma don't have a choice. There's nothing that's predictable about it, except maybe the unexpected may be predictable. I know today is not going to look like tomorrow, and tomorrow is not going to look like the next day and last year or in the future. So predictability is extremely helpful to our trauma students. Number three, foster trusting relationships. Build supportive relationships because children struggle with trusting others when they've experienced trauma. The person who's supposed to love them the most may be treating them the worst, and that's unfortunate. How do we build or foster these relationships? We be consistent with our words and actions. Small actions build trust. If you're going to say after you finish this assignment, you're going to get to go to the treasure box, make sure you follow through. If you say you can eat your snack, even a small thing, after lunch, we'll go to recess and have a snack. What if it's raining? That student doesn't understand that. What they understand is that you said it and you didn't do it. So you'll have to explain to them one-on-one, not in front of everybody, and say, hey, it's raining today, so maybe tomorrow, okay? Number four, promote emotional regulation and coping skills. I know a lot of our teachers are going to push back on this. Well, we don't know how to do this or how to do that. Well, here I'm helping you to understand that. Teach how to manage emotions, coping with stress, in healthy ways to regain control. I know as adults, we struggle with the same thing. Please contact your counselor if you find it challenging for you. How do we do this? We share calming strategies. One easy way is just to give them space to breathe. Let them do a hallway walk. If you have someone else in your classroom or there's a teacher that might be close, ask them if they could sit in and we're going to just take a walk to the end of the hall and back. Call on another student who seems to be friendly with the student and let them sit there with them, the back of the room, and just relax. Number five, empower the child to build resilience. Promote opportunities to make choices. And this helps them to feel competent and allows sense of self-control and mastery over their own lives. Again, students who have experienced trauma don't have a choice. We're saying, oh, we're going to give them choices. Choices, they all have choices. Some who experience trauma do not. And it's our job to provide them with that in school to make them feel safe. And how do we do that? We let the child choose how to solve the problem. Do math or do reading. You have 10 minutes. You have a choice. Remember, behavior is often a response to trauma. By applying these principles, you can create an environment that helps them heal, grow, succeed despite the effects of their trauma. As educators, we're here to educate. And sometimes it also means doing so not just academically, but socially and emotionally. I hope this helps. Remember to like and share and comment if you have any questions. Thank you.